Swayam Prabha. Digital India. Educated India.
Good morning. I am Dr. Kalpana Ramachandran, Professor and Head, Department of Anatomy, Sri Ramachandra Medical College and Research Institute, Chennai, Tamil Nadu. In today's session, we will be discussing about the general arrangement of spinal cord, that is, its external and internal features. The objectives of this lecture are, at the end of this lecture, you should be able to describe the external and internal features of the spinal cord and also describe the extent of spinal cord in child and adult with its clinical implications. Let us start this lecture with a clinical anatomy case study. A 5-year-old child was brought to the casualty with the complaints of high fever, neck pain, irritability and refusing to eat. A diagnosis of acute meningitis was made. A lumbar puncture was done in order to confirm the diagnosis. So, using your knowledge of neuroanatomy, answer the following questions. Where would you perform a lumbar puncture? And also, name the structures pierced when a lumbar puncture needle is inserted into the subarachnoid space. We will discuss this case study at the end of this lecture. We will start with the introduction to the spinal cord. As you all know, the central nervous system consists of brain and spinal cord. So, the spinal cord is the lower elongated part of the central nervous system, which is cylindrical in shape. It is also flattened antero-posteriorly. This is the cord which is seen. This is the spinal cord in situ within the vertebral column. So, the spinal cord occupies upper 2/3 of the vertebral column. You can see from this picture that it occupies the upper 2/3 of the vertebral column. As you all know, spinal cord is the continuation of the medulla oblongata. The extent of the cord is from the upper border of posterior arch of atlas. This is the first cervical vertebra, atlas. So, from the upper border of the posterior arch of atlas to the lower border of L1 vertebra. So, the spinal cord terminates at the lower border of L1 vertebra. Coming to the measurements, in adult male, the length is 45 centimeters and in case of females, it is 42 centimeters. The average diameter is 1.25 centimeters and it weighs 30 grams. So, the spinal cord ends at the lower border of L1 in a tapering extremity. You can see from this picture that the cord is ending in a tapering extremity which is called as conus medullaris. Okay. The cord is ending in a conical tapering extremity which is called as conus medullaris. From this picture you can make out that from the apex of the conus medullaris, a thin filamentous structure is extending which is nothing but made up of pia mater. This thin filamentous structure is called as phylum terminale. We will discuss details of phylum terminale in the later slides. The functions of the spinal cord are 1. Transmission of impulses to and from the brain and also for execution of simple reflex. Next, we will study the positional changes of the cord. If you look at the cord during fetal life, that is up to 3rd month of fetal life, the cord will extend throughout the length of the vertebral column. Afterwards, what happens is the vertebral column is going to grow faster. and hence when the baby is born, the spinal cord ends at the level of L3 vertebra. There is a rostral shift of the spinal cord. In case of adults, the spinal cord ends at the level of lower border of L1. If you extremely flex the vertebral column, what happens is the cord ascends to the lower third of T12 vertebra. In a 5-year-old child, the spinal cord terminates at the level of second lumbar vertebra. Certainly, it will extend no lower than third lumbar vertebra. Coming to the coverings of the spinal cord, which I will be briefly describing. From this picture, you can note that from outside inwards, there are 3 coverings. Outermost will be the dura mater. Next layer will be the arachnoid mater. Innermost, closely investing the cord, will be the pia mater. So, from outside inwards, dura, arachnoid and pia mater. If you take the dura mater of the covering the cord, it is going to extend from foramen magnum to the lower border of S2, second sacral vertebra. So, the space between the dura mater and the vertebral column, this space is where I am pointing, is called as epidural space. Epidural space contains loose areolar tissue, semi-liquid fat and also internal vertebral plexus. It is a venous plexus. The space between dura and arachnoid is called as subdural space, which contains a capillary layer of fluid. The space between the arachnoid and the innermost covering closely investing the cord, pia mater, is called as subarachnoid space. What is pointed out in the picture is the subarachnoid space, which is filled with cerebrospinal fluid, CSF. If you take the spinal dura mater, it differs from the cranial dura mater. We will look at the differences between spinal dura and the cranial dura. The spinal dura, as I have already said, is just a single layer which consists of only the meningeal layer as compared to the cranial dura mater. As you have already studied, the cranial dura mater is 2-layered. That is, it consists of an outer endosteal layer and an inner meningeal layer. 2 layers of the cranial dura are outer endosteal layer and an inner meningeal layer. This is the first difference between the spinal dura and the cranial dura. If you look at the cranial dura mater, it is going to form 4 folds. Those folds are falx cerebri, falx cerebelli, tentorium cerebelli and diaphragma cellae. These 4 folds are folds of the cranial dura mater. But if you take the spinal dura mater, it does not form folds. As I have already mentioned, the space between the vertebral column and the dura mater is called as epidural space. This space is present between the spinal dura mater and the vertebral column. But in case of cranial dura mater, there is no space between the bone and the dura mater. So, epidural space is absent. These are the 3 major differences between the spinal dura and the cranial dura. Having looked at the differences between spinal and cranial dura mater, we will move on to the next layer, arachnoid mater. As I have already mentioned, from outside inwards, it is dura mater, arachnoid mater, and closely investing the cord will be the pia mater. But if you look at the arachnoid mater, it is a thin, delicate, transparent avascular membrane. This is going to loosely invest the cord. This invests the cord loosely. You can see in the picture below also. Like dura mater, it also extends up to the lower border of second sacral vertebra. This is very important. The dura mater and arachnoid mater will extend till the level of lower border of second sacral vertebra. Next is the pia mater. As I already told you, pia mater closely invests the cord, is very thin. It's a vascular membrane, highly vascular membrane which is covering the cord, and below the termination of cord, that is the termination of cord, we called it as the conical structure, that is the conus medullaris. From the apex of the conus medullaris, this pia mater, as you can see from the picture, is going to extend as a thin filamentous structure that is called as phylum terminale. As I mentioned earlier, you can see the subarachnoid space. This subarachnoid space is between the arachnoid mater and the pia mater, which is filled with cerebrospinal fluid. Please have a look at this picture where you can see that beyond the termination of the cord, the subarachnoid space, what you see here around the phylum terminale is roomy, and hence the pool of CSF is seen in this place. This is called as lumbar cistern. It's called as lumbar cistern, and this is the preferred site for lumbar puncture to withdraw the CSF. So, having talked about the pia mater, we will discuss some more details about the phylum terminale, which you can see in this picture. As I already mentioned, phylum terminale, it is a glistening white structure. You can see in this picture, it is extending from the tip of the conus medullaris. You can see here, extending from the tip of conus to the dorsal surface of coccyx, first coccygeal vertebra. So, from the tip of the conus medullaris to the dorsal surface of first coccygeal vertebra. So, it is composed of pia mater. If you take the cord, it has got the central canal in the grey commissure. This central canal is going to extend into the phylum terminale just for about 5 millimeter. Initial segments of the phylum terminale will contain the central canal. The length of the entire phylum terminale, what you are seeing here, is 20 centimeters. There are two parts of the phylum terminale. One is phylum terminale internum, another one is phylum terminale externum. You call it phylum terminale internum if it is going to lie within the dural sac or within the subarachnoid space. That is till the level of S2, it is the phylum terminale is lying within the dural sac, or it's lying within the subarachnoid space. As I already told you, the dura and arachnoid are going to extend till the level of S2. So, the subarachnoid space also extends till the level of S2. So, the part of the phylum terminale within the dural sac or the subarachnoid space, which is 15 centimeters long, this is called as phylum terminale internum. So, from S2 to the dorsal surface of coccyx, this part of the phylum terminale is called as phylum terminale externum. Why it is called externum? It is because it is lying outside the dural sac, that is below the level of S2. It is extending till the dorsal surface of the coccyx. So, this is about the phylum terminale, which is composed of pia mater. So, the important clinical anatomy for this is lumbar puncture. So, lumbar puncture is a procedure to withdraw cerebrospinal fluid. As has been mentioned, CSF is in the subarachnoid space. So, you can withdraw CSF for
various diagnostic and also therapeutic purpose. The importance is you should know where to do the lumbar puncture. It is preferred to do the lumbar puncture below L1, lower border of L1, because lower border of L1 your spinal cord ends. If you ascend up, there is a likely chance of injuring the cord. So, it is usually the lumbar puncture to withdraw the cerebrospinal fluid is usually done in the interspinous space between L3 and L4 where the needle is inserted. So, to identify the L3, L4 interspinous space, you can draw a horizontal line at the highest point of iliac crest. Both iliac crests you join by a horizontal line. This line will correspond to the spine of L4 vertebra. You just go above that, that will be the interspinous space between L3 and L4. That is the space through which the lumbar puncture needle can be inserted. So, you can see in the picture above that the needle is inserted in the interspinous space between L3 and L4. Because in this space, if you insert and go to the subarachnoid space, the subarachnoid space is roomy. It only contains phylum terminale and cauda equina. So, once you put the needle into the interspinous space, you will be piercing various structures. So, look at the picture below. You will be piercing the skin, fascia, then will be the supraspinous ligament, interspinous ligament, ligamentum flavum, then your dura, arachnoid, and you will be entering the subarachnoid space. So, interspinous space between L3 and L4 is the most preferred site. You can directly insert the needle, go to the subarachnoid space and withdraw cerebrospinal fluid for diagnostic and also for therapeutic purposes. So, this completes the coverings of the cord. Next, we will be talking about spinal segments. So, what is a spinal segment? In this picture, you can see that the spinal cord is within the vertebral column and you can see the trunk of the spinal nerve emerging through the intervertebral foramina. We will look at the details in the next slide. So, what is a spinal segment? Spinal segment is the portion of a cord which is going to give attachment to pair of spinal nerves. The portion of the cord which gives attachment to pair of spinal nerves is called spinal segment. In this, two segments are shown. Please understand that this segment, spinal segments, is arbitrary. That means there is no surface demarcation between one segment and another segment. So, a spinal segment is a portion of the cord which gives attachment to pair of spinal nerves. As you all know, there are 8 pairs of cervical nerves, 12 pairs of thoracic nerves, 5 pairs of lumbar nerves, 5 pairs of sacral nerves and 1 pair of coccygeal nerves, making up to 31 pairs of spinal nerves. So, each spinal nerve, this is a pair which is shown, each spinal nerve, a typical spinal nerve is attached to the cord. This is the spinal cord. You can see the inner grey matter and outer white matter. It is attached to the cord by 2 roots, a ventral root and a dorsal root. The dorsal root presents a ganglion which is called dorsal root ganglion. Both roots, ventral root is motor, dorsal root is sensory. Both roots join and form the typical spinal nerve which will come out of the intervertebral foramina. This typical spinal nerve divides into a ventral ramus and a dorsal ramus. So, we are at present talking about the spinal segments. So, if you look at the spinal nerves which are emerging from the spinal cord, you can see the cord in situ ending at the level of L1. If you look at the cervical spinal nerves from C1 to C7, they emerge above the pedicle of the corresponding vertebra. But if you take C8 spinal nerve, it will emerge below the pedicle of the C7 vertebra. This is because there are 8 pairs of cervical nerves, but only 7 cervical vertebra. Below this level, all the spinal nerves are going to emerge below the pedicle of the corresponding vertebra and they come out through the intervertebral foramina. The lower 4 pairs of lumbar nerves, 5 pairs of sacral nerves and 1 pair of coccygeal nerve, they are going to take a vertical course, go around the phylum terminal to reach their corresponding intervertebral foramina. This is because the cord is going to end at the level of lower border of L1. There is a cranial shift or rostral shift of the cord. So, the lower 4 pairs of lumbar nerves, 5 pairs of sacral nerves and 1 pair of coccygeal nerves take a vertical course and they reach the corresponding intervertebral foramina. So, these nerves, that is the lower 4 pairs of lumbar nerves, 5 pairs of sacral nerves and 1 pair of coccygeal nerves take a vertical course and they form a bunch around the phylum terminal. You can see in this picture, they form a bunch around the phylum terminal which is shown in white color. So, this bunch of nerves is called as, cauda equina. Cauda equina means it resembles a horse's tail. Cauda means tail, equina means horse. So, this is called as cauda equina. The cauda equina hence is composed of lower 4 pairs of lumbar nerves, 5 pairs of sacral nerves and 1 pair of coccygeal nerves. There is a syndrome called as cauda equina syndrome. Suppose the cauda equina is compressed. Usually it involves the sacral nerve roots. It can be compressed by a extradural tumor or by an intervertebral disc which is prolapsed, or sometimes the patients can have spinal canal stenosis. In these conditions, the cauda equina can get compressed. This is called as cauda equina syndrome. So, this syndrome patients presents with lower motor neuron type of paralysis. There is going to be saddle shaped anesthesia. Patient will also complain of severe root pain. In a later stage, patient can have urinary and bowel retention. So, we have talked in detail about the cauda equina and its applied anatomy. Having understood this, there is a relation between the spinal cord segment and also the vertebral numbers. As I already mentioned, there is a rostral shift of the cord, that is, cord is ending at the level of L1. So, if you take a particular vertebra, which is represented usually by the vertebral spine, the underlying spinal segment will be caudal to the corresponding vertebra. That is, there is a relation between the spinal cord segment to the vertebral numbers. So, if you want to know the underlying spinal segment corresponding to the vertebra, that is represented by the vertebral spine, there is a way to calculate it. So, in case of C1 to C7 spines, if you want to know the underlying spinal segment, you have to add 1. That is, if it is C7 vertebra, underlying will not be C7 spinal segment. You add 1, it will be underlying will be C8 spinal segment. As I already mentioned, this is because of the rostral shift of the cord and it is ending at the level of lower border of L1 vertebra. In T1 to T6 vertebra, you have to add 2. T7 to T9 vertebra, add 3. That is, T9 vertebra corresponds to, you add 3, will correspond to T12 spinal segment. There comes the importance of spinal segment. So, T10 vertebra corresponds to L1 and L2 segment of the cord. T11 vertebra underlying will be L3 and L4 spinal segment. T12 corresponds to L5 spinal segment. And L1 vertebra, that is the point where, this is L1 vertebra, that is the point where your spinal cord ends. Underlying is not the L1 segment, but it is the sacral and coccygeal segments. This is because spinal cord has shifted rostrally and ending at the level of L1. So, L1 vertebra will not correspond to L1 segment. Actually, it is the sacral and coccygeal segment. So, underlying a vertebra, the spinal segment will be caudal due to the rostral shift of the cord. So, this is the relation between the spinal cord segment to the vertebral numbers. Next, we will talk about the enlargements of the cord. You can see this is the cord. There are two enlargements, one cranially, that is cervical, another one is lumbar enlargement. These are because of the nerve roots which are contributing to the formation of brachial and lumbosacral plexus. So, this contributes to the formation of two enlargements, cervical and lumbar segments. We will look at some of the details of these two enlargements. So, in cervical enlargement of the spinal cord, you can see that it accommodates large motor neurons which supply the muscles of the upper limb. Lumbar enlargement accommodates large motor neurons which supply the muscles of the lower limb. Having learnt the spinal segment, so the cervical enlargement will extend from C3 to T2 spinal segments, and lumbar enlargement will extend from L1 to S3 spinal segments. If you look at the maximum circumference, it is 38 millimeter in C6 segments for cervical enlargement, and for lumbar enlargement, maximum circumference is opposite to L5 segment. These are the two enlargements of the spinal cord. So, we will summarize what we have learned till now. As I already mentioned, spinal cord, the extent is from the upper border of posterior arch of atlas to the lower border of L1. The conical tapering extremity of the cord is called as conus medullaris. From the apex of the conus medullaris, you can see that there is a thin filamentous structure extending, which is composed of pia mater. It is called as filum terminale. The filum terminale has got a part which is within the subarachnoid space, which is called as filum terminale internum, which is 15 centimeters long. A part of the filum terminale outside the dural sac extending from S2 till the dorsal surface of coccyx, this is called as filum terminale externum, which is about 5 centimeters long. So, the coverings of the cord, as we have learnt from outside to inside, will be dura mater, arachnoid mater, innermost will be the pia mater. Between the arachnoid mater and the pia mater will be the subarachnoid space. Chorda equina is composed of lower 4 pairs of lumbar nerves, 5 pairs of sacral nerves and 1 pair of coccygeal nerves. We learnt about two enlargement opposite to the attachment of nerve roots contributing to the formation of brachial plexus, that is cervical enlargement, and opposite to the nerve roots contributing to the formation of lumbosacral plexus, that is called as lumbar enlargement. Having learnt these, We will move on to the next section, that is the external features of the spinal cord. This is a cross section of spinal cord which is seen. We will be now studying the external features of the cord. This is anterior view, anterior surface of the cord, and this is posterior part of the cord. So, there is an anterior median fissure and a posterior median sulcus. This is a posterior view. This divides the cord into two symmetrical halves, an anterior median fissure and a posterior median sulcus and a septum divide the cord into two symmetrical halves. So, in the anterior aspect, you can see an anterior median fissure, and on either sides you can see two anterolateral sulci. We will discuss in detail about this in the next few slides. On the posterior aspect, you see a posterior median sulcus, two posterior intermediate sulcus and two posterolateral sulci. A posterior median sulcus, two posterior intermediate sulcus and two posterolateral sulci. So, anterior and posterior views of the cord, you have various fissures and sulci. We will be discussing the details of these fissures and sulci. So, this is the anterior view. First is the anterior median fissure. It is a fissure which is 3 mm in width. It is deep and it is extending through the entire length of the cord. As you can see from this picture, this anterior median fissure is extending through the entire length of the cord, and the structure present in the anterior median fissure will be anterior spinal artery. On either sides of the anterior median fissure, you can see the ventral roots are emerging. This sulci is called as anterolateral. This is on either sides of the anterior median fissure. So, we call this sulci where the ventral roots are emerging as the anterolateral sulci on either sides. Having learned the anterior aspect, we will move on to the posterior aspect. So, on the posterior aspect, you can see a sulcus which is just 1.5 to 2 mm. It is not very deep. So, it is a faint groove. It is a faint groove that is called posterior median sulcus. From the posterior median sulcus, see this picture below, a septum of neuroglial tissues extending till the grey commissure. This is called as posterior median septum. It is called as posterior median septum. So, this is posterior median sulcus, and from the posterior median sulcus, a septum is extending till the grey commissure, that is called as posterior median septum. On either side of the posterior median sulcus, you see the posterior intermediate sulci and two posterolateral sulci. Where the dorsal roots are emerging, you can see two posterolateral sulci. So, this picture shows that each half of the cord is divided into anterior, lateral and posterior regions because of the presence of anterolateral sulci anteriorly, two anterolateral sulci anteriorly and two posterolateral sulci posteriorly. Please understand that anterolateral sulci, ventral roots are emerging. This is posterior view. Posterolateral sulci on either sides, the posterior roots are emerging. Ventral root and dorsal root join and they form the typical spinal nerve, which is both motor and sensory. This we have learnt it already. So, this is about the external features of the cord. Now, we will study the internal features of the cord, spinal cord. This is spinal cord in situ, this is anterior, you have the vertebral body, this is spinous process, here you have the pedicles, these are the lamina, these are the transverse process. This is the vertebral canal in which you can see the spinal cord. So, in a section, cross section, the spinal cord shows inner grey matter and outer white matter. Now we are going to discuss in detail about the grey and white matter. So this is just a picture to show the grey matter and the white matter. So the spinal cord in a cross section shows inner grey matter which is H-shaped and the outer white matter. So this inner grey matter is H-shaped. It has two ventral grey horns, two dorsal grey horns, two ventral grey horns and two dorsal grey horns, and these two right and left grey horns are joined by a grey commissure. This is the grey commissure in which you have the central canal. So if you look at this picture, you can see that this is the ventral grey horn and this is the dorsal grey horn. So what is grey matter? Grey matter is composed of nerve cell bodies, neuroglia and blood vessels. Why it is called as grey matter? The predominance of the neuronal somata, that is the nerve cell bodies, gives it a greyish appearance. So grey matter is composed of nerve cell bodies, that is the neuronal somata, neuroglia and also blood vessels. So the predominant structure which is present in the grey matter is the neuronal somata or the nerve cell bodies. That gives a greyish appearance to the grey matter. So we will first study the ventral grey horn. As you can see from the picture, the ventral grey horn is broad and short and it extends ventrolaterally. Please understand, this is ventral, this is dorsal. So this anterior grey horn or ventral grey horn is going to extend ventrolaterally. If you look at the dorsal grey horn, it is long and slender. It is extending dorsolaterally, long and slender, and it is extending dorsolaterally. So if you look at the ventral or anterior grey horn, it has got a head. This is the head and this is the base. Head and the base for the ventral grey horn. If you take the dorsal grey horn, it has got a apex. This is the apex. Then it has got a head. Then this is the neck and this will be the base. So you have a base for the anterior grey horn. You have a base for the posterior grey horn. And between the both the bases will be the intermediate region. This is the intermediate region which I am pointing out. The arrow mark shows the intermediate region. I repeat, ventral grey horn has got a head and a base. The posterior grey horn or the dorsal grey horn has got an apex, head, neck and a base. Between the bases of the grey horns will be the intermediate region. This is the intermediate region. This intermediate region is prolonged laterally as the lateral grey horn. What you can see, I am pointing out is the lateral grey horn. Where is it seen? It is seen only from T1 to L2 or L3 segments of the spinal cord. Lateral grey horn is present only in the thoracic and upper lumbar segments of the spinal cord. So lateral grey horn is seen from T1 to L2 or L3 segments of the spinal cord. So these are the grey horns which are connected by a grey commissure. You can see that this is a grey commissure. It connects identical areas of right and left grey matters. So the central canal, if you look at it, it is ventral in position in case of cervical and thoracic segments of the spinal cord. In cervical and thoracic segments of the spinal cord, the central canal is ventral in position. It is central in position in the grey commissure in case of lumbar segments of the cord. It is dorsal in position, it moves to a dorsal position in sacral segments of the cord. This is the central canal. If you look at the central canal, this is a picture to show the central canal. It is lined by ependyma. The central canal of the spinal cord above will be continuous with the central canal of the closed part of the medulla. Then above it is continuous with the fourth ventricle. This is the central canal lined by ependyma. As you all know, ventricles are lined by ependyma. Surrounding this, you have neuroglial tissue which is called as substantia gelatinosa centralis. The neuroglial tissue, what you are seeing here surrounding it, surrounding the central canal, is called as substantia gelatinosa centralis. So, this is the central canal. We will go back to the previous slide and see the central canal again. Okay. This central canal, ventral to it, the grey matter which is present is called as ventral grey commissure, and dorsal to it what is present is called as dorsal grey commissure. You have a ventral grey commissure and a dorsal grey commissure. You call it ventral and dorsal in relation to the central canal. This is about the ventral and dorsal grey commissure. So, you come anterior to the grey commissure. Here you can see the anterior median fissure. Between the anterior median fissure and grey commissure, this is called as anterior white commissure. Please note, anterior median fissure does not reach the grey commissure. So, there is an area of white matter between the anterior median fissure and the grey commissure. This portion is called as anterior white commissure. Anterior white commissure. Look at the posterior aspect. I already mentioned this is posterior median sulcus. This is the posterior median sulcus, and from there you can see the posterior median septum. This is the posterior median septum. When I talked about the external features, I told you there is a neuroglial tissue which is extending, a septum which is extending from the posterior median sulcus into the cord, that is called as posterior median septum. It reaches the grey commissure. It is going to reach the grey commissure. Please note, there is no posterior white commissure because the posterior median septum is coming in contact with the grey commissure. So, this is the posterior median septum, no posterior white commissure. This is grey commissure, and anterior to it is the anterior white commissure. This is the anterior median fissure. One more thing you must note in this diagram is that we talked about a posterior intermediate sulcus on either side. From there a septum is extending, that is called as posterior intermediate septum. This is the posterior intermediate septum. So, above the mid-thoracic region, this posterior intermediate septum is present. That is, the posterior intermediate septum is present above the mid-thoracic segments, that is in cervical and upper thoracic segments. So, this divides this posterior white column, this is the posterior white column, into a medial part and a lateral part. This medial part will be occupied by fasciculus gracilis and lateral part will be occupied by fasciculus cuneatus. Where is this posterior intermediate septum present? Only in the cervical and upper thoracic regions. This posterior intermediate septum is visible. So, this completes the grey matter. Coming to the white matter, we divided the grey matter into anterior grey horn, posterior grey horn, lateral grey horn. Now, we will talk about the white matter. White matter is composed of nerve fibers, neuroglia and blood vessels. The whitish appearance is because of the myelinated nerve fibers. That is why it is called as white matter, the myelinated nerve fibers. So, white matter is composed of nerve fibers, neuroglia and blood vessels. So, if you look at the white matter itself, it is divided into anterior white column, lateral white column and posterior white column. You can also refer them as anterior funiculus, lateral funiculus and posterior funiculus. So, this anterior white column is between anterior median fissure and the most lateral fibers of the ventral root. You can see the ventral roots emerging. So, between the anterior median fissure and the most lateral fibers of the ventral root is the anterior white column or anterior funiculus. From the ventral root fibers to posterolateral sulcus is the lateral white column or lateral funiculus. From the posterolateral sulcus to posterior median septum, this portion is called as posterior white column or posterior funiculus. So, the white matter is divided into anterior white column, lateral white column and posterior white column, or it is called as anterior funiculus, lateral funiculus and posterior funiculus. These white columns we will refer to again when we talk about the position of tracts in these white column. Having learnt this, we will move on to the neurons in the grey matter. We are now going to discuss in detail about the grey matter. For this, you have to know the classification of neurons in the grey matter. There are two ways by which you can classify. There is a structural classification and a functional classification. So, if you take the structural classification, the neurons are divided into Golgi type 1 and type 2. The only difference is that type 1 has got long axon, they leave the grey matter. Golgi type 2 have short axons, they are present within the segment, that is intrasegmental, or it can be intersegmental. So, that is Golgi type 1 and type 2. Functionally, if you classify, you can divide the neurons in the grey matter as motor neurons and sensory neurons. Please understand that ventral grey horn is motor. So, you have motor neurons present in it. So, it is present in the anterior ventral grey horn and also in the lateral grey horn. So, the type of motor neurons are alpha neurons and gamma neurons. The only difference is alpha neurons are large multipolar, gamma neurons are small multipolar. Alpha neurons supply extrafusal skeletal muscle fibers, but gamma neurons will supply the intrafusal muscle fibers present in the muscle spindle in skeletal muscle. So, motor neurons are present in the anterior grey horn and lateral grey horn, and sensory neurons are present in the posterior grey horn. So, they are involved in relay of sensory information to different parts of the brain, and hence they form the ascending tracts. So, sensory neurons are seen in the posterior grey horn and motor neurons are present in the anterior and lateral grey horns. This is the functional classifications of neurons in the grey matter. Having learned this, now we are going to take the grey matter separately and learn the various neurons which are grouped, the collection of nerve cell bodies inside the central nervous system is called as nucleus. So, we are going to learn the various nuclei which are present in the grey matter. As I already mentioned that grey matter is composed of nerve cell bodies, that is, there is predominance of neuronal somata. So, these neuronal somata or nerve cell bodies are collected and they are forming what is called as nucleus. Please understand that nucleus is a collection of nerve cell bodies inside the central nervous system. This is very important. Collection of nerve cell bodies within the central nervous system is called as nucleus. So, in spinal cord, in the grey matter, we are going to see the various nuclei which are present. So, we will talk about each of these grey horns or column. Anterior grey horn, posterior grey horn and lateral grey horn. What are the various nuclei which are present? First, we will take the anterior grey horn. What you are seeing in this picture, this is the anterior grey horn, this is the posterior grey horn, and here will be the lateral grey horn. So, first we will take the anterior grey horn. The nuclei which are present in the anterior gray horn are divided into, this is medial group of nuclei, this is central group of nuclei, and this is lateral group of nuclei. Medial group of nuclei, central group of nuclei, and lateral group of nuclei. The medial group of nuclei itself will divide into ventromedial, what I am pointing out, and this is dorsomedial. This is ventral, this is dorsal. This is anterior gray horn, this is posterior gray horn. This is gray commissure, and this is the central canal. So, having known this, please note we are talking about the nuclei in the anterior gray horn. So, the most medial is the medial group of nuclei. We are again subdividing into ventromedial and dorsomedial. So, the axons from this, I told you this is all motor neurons. The axons from this are going to leave the ventral root through the spinal nerve. They go and innervate skeletal muscles of the neck and trunk. That is, they supply the abdominal and intercostal muscles, and also muscles which are present in the neck. So, these are the medial group of nuclei which is going to innervate skeletal muscles of the neck and trunk, including abdominal and intercostal muscles. Coming to the central group, please see in this picture, there are two important nucleus in the central group. This central group is present only in cervical and lumbar segments. So, in C3, C4, C5 segments, the nuclei which are present are called as phrenic nucleus. You can see the phrenic nucleus marked here. So, this phrenic nucleus, axons of this will go and innervate the diaphragm. Then you can see anterior to it the accessory nucleus. So, nerve cells of the upper 5 or 6 cervical segments, they are going to form the accessory nucleus, the axons of which go and innervate sternocleidomastoid and trapezius muscle. There is one more nucleus in the lumbosacral region segments, that is called lumbosacral nucleus, extending from L2 to S3 segment. The functions not known. So, we talked about medial group of nuclei, central group of nuclei. We are going to lateral group of nuclei. So, lateral group of nuclei are present in cervical and lumbosacral segments. Please understand, this is a very important group of nuclei which innervate the skeletal muscles of the limbs. So, in this itself we divided into ventrolateral, then dorsolateral, retrodorsolateral. So, three subdivisions of the lateral group of nuclei: ventrolateral, dorsolateral, retrodorsolateral. So, ventrolateral group of nuclei, the axons of which will supply the muscles of the arm and thigh. In this, one nucleus is important, nucleus of Vonef in the ventrolateral group, in S1 and S2 segments supply the perineal muscles. Dorsolateral group of nuclei, the axons of which go and supply the muscles of the forearm and the leg. Retrodorsal group supplies the intrinsic muscles of the foot and hand. So, you can see that the arm, forearm, hand are innervated by various groups of nuclei: ventrolateral, dorsolateral, retrodorsolateral. Same thing holds good for the lower limb also. That is why initially I mentioned that lateral group innervates skeletal muscles of the limbs. So, anterior gray horn, we have a medial group of nuclei, central group of nuclei, and lateral group of nuclei. Having learned this, we will go to the nuclei which are present in the posterior gray horn. So, first is the postromarginal nucleus, which caps the posterior gray horn, and it receives some incoming dorsal root fibers. Come and end here. Next nucleus, what you are seeing here is substantia gelatinosa, very important nuclei which is present throughout the cord. It receives afferent fibers concerned with pain and temperature touch from the posterior root. It is an important second order neuron in the spinothalamic tract. So, this receives, so these are all sensory neurons, so it receives fibers, that is which sensations are received? The substantia gelatinosa, it is going to receive fibers concerned with pain, temperature and touch from the posterior root. Anterior to it, you see a large nucleus. This large nucleus is called nucleus proprius. This nucleus proprius, as the name suggests, it receives fibers from posterior column associated with sense of proprioception. That is, the sense of position, movement, and also 2-point discrimination and also vibration sense. So, this nucleus proprius receives fibers associated with sense of position movement, that is proprioception, sense of position movement of the joint limbs, and also it receives 2-point discrimination and vibration sense, that is nucleus proprius. Next nucleus what you are seeing coming to the base of the posterior grey horn, you can see a huge nucleus here, that's called as dorsal nucleus, or it's called as nucleus dorsalis or thoracis, or it's called Clerk's column. So this is group of nerve cells at the base. It is going to base of the posterior grey horn. It is present in which segments? C8 to L3 or L4 segments. So it also receives proprioceptive afferents, muscle and joint sense, and also exteroceptive afferents, touch, pressure from trunk and limbs. This is the second order neuron in spinocerebellar pathways. Lateral to it, you see the visceral afferent nucleus, which is seen in T1 to L2 or L3 segments and S2 to S4 segments of the cord. This receives fibers from the viscera, afferent fibers from the viscera through the dorsal nerve root. So, we have learned nuclei which are present in the anterior grey horn, posterior grey horn. Now, we will concentrate on the intermediate area. In the intermediate area, you have a lateral nucleus, intermediolateral and intermedio-medial nucleus. Intermediolateral nucleus, that is only prolonged as the lateral grey horn. So, this nucleus is present, I told you, it is extending from lateral grey horn, extends from T1 to L2 or L3 segments of the spinal cord. So, this forms part of the thoracolumbar outflow, that is your preganglionic sympathetic fibers. So, the axons arising from this are going to pass through the ventral root. This forms the preganglionic sympathetic fibers. As you all know, sympathetic outflow is thoracolumbar outflow. So, it is extending from T1 to entire thoracic segment of the cord, you have a lateral grey horn, and also till L2 or L3 segments you have a lateral grey horn. That corresponds to the intermediolateral nucleus. The axons arising from this are going to form the preganglionic sympathetic fibers. So, that is intermediolateral. Intermediomedial nucleus is present in S2 to S4 segments of the cord. S2 to S4 segments of the cord. It is going to give origin to preganglionic parasympathetic fibers. As you all know, parasympathetic outflow is craniosacral outflow. The sacral outflow is going to start from the intermediomedial nucleus. So, which segments of the cord this intermediomedial nucleus is present? It is extending from S2 to S4 segments of the cord. So, these are the nuclei which are present in the ventral grey horn, the posterior grey horn, and also the intermediate region. Some of the books mention grey column. I just want to mention that in a 3-dimensional view, the cord segments, the spinal cord segments appear like pillars, and hence it's called as a column. Here we call it grey horns. This picture we should call it as anterior grey horn, posterior grey horn, and in thoracic and lumbar segments we call it as grey horns, lateral grey horns. If in a 3-dimensional view, the spinals, if it is the cord is viewed, the segments are viewed, it appears like pillars. Hence, we can call them as grey columns. Column means it's like a pillar. So, these are the various nuclei which are present in the grey horns. Now coming to the having learned the grey matter, we learned various nuclei, that is collection of nerve cell bodies within the central nervous system. So outside we talked about the white matter. We told white matter is composed of nerve fibers, neuroglia and blood vessels. So this white matter contains various tracts. Next lecture will be on the various tracts of the spinal cord. I will just mention the position of the various tracts in relation to white matter. So white matter, as I mentioned, is composed of nerve fibers, neuroglia and blood vessels. So if you take the white matter, it is composed of various tracts. So tract is nothing but a collection of nerve fibers within the central nervous system, which have same origin, course and termination. They are sometimes called as fasciculi, that is bundles, or lemnisci, that means like ribbons. So the white matter, the nerve fibers which are going to get collected and they form the tracts. These tracts have same origin, course and termination, and they are named after the masses of grey matter they are going to connect. So that is the tract. Please look at this picture. You can see the various tracts, descending and ascending tracts which are present in the various white column, anterior white column, lateral white column and posterior white column. One side, on the right side of what I am trying to show, is shown the ascending tracts. On the left side is shown the descending tracts. This is for picture purpose, that both ascending and descending tracts are seen on both sides. For your understanding, the picture shows ascending tracts on one side and descending tracts on other side. This tabular column will summarize what are the various tracts, ascending and descending tracts, which are present in the white matter. So if you look at the descending tracts, in the posterior white column, there is no descending tract. In the lateral white column, you see here you have lateral corticospinal tract, the important tract. Then you have rubrospinal and lateral reticulospinal. Along with that can be hypothalamospinal. In the anterior white column, you have anterior corticospinal. On either sides of the anterior median fissure, you will see the anterior corticospinal. Other than that, smaller tracts like vestibulospinal, tectospinal and medial reticulospinal are seen. All these are labeled in the picture. This side shows the ascending tracts. In the anterior white column, you can see the anterior spinothalamic tract. In the lateral white column, you see the lateral spinothalamic tract and two tracts which are going to the cerebellum, that is anterior spinocerebellar and posterior spinocerebellar tracts. In the posterior white column, you can see two important tracts which constitute the posterior column pathway. There are two tracts, medially fasciculus gracilis, I have already mentioned, and laterally fasciculus cuneatus. They are also given other names. Fasciculus gracilis is called as tract of Gall and fasciculus cuneatus is called as tract of Burdag. These two tracts are called as posterior column pathway. They occupy the posterior white column. Another name given for this is also called as medial lemniscal pathway. This will be discussed in the second part of the lecture on spinal cord on tracts. So this is the position of the tracts. So we have learnt the various nuclei which are present in the grey matter. We have also learnt the various tracts which are present in the white matter. So there is a laminar pattern or layered pattern of the grey matter which is called Rexed lamina. It was Rexed who described this. This cytoarchitecture of the grey matter is divided into 10 lamina. This can be learned by studying the thick and thin sections of spinal cord of neonatal, young and adult cats. which showed the laminar pattern. Please understand this is useful only in experimental work, and also it provides information about the localization of various terminal degenerating fibers after the section of a posterior nerve root or a descending nerve tract is done. So this is the application of knowing the laminar pattern. So you can just look at the picture that 1 to 10 lamina are labeled. As you all know, this is anterior grey horn, this is posterior grey horn, this is the intermediate region, this is the central canal, and this is the grey commissure. So lamina 1, as pointed out in the picture, lamina 1 corresponds to postero-marginal nucleus. Lamina 2 is substantia gelatinosa. We have learnt all these in the previous slides. 3 and 4, lamina 3 and 4 corresponds to nucleus proprius. So 1 to 4 corresponds to head of dorsal grey horn or grey column. 5 is neck of dorsal grey horn. You can see in this picture, this is 5. 5th lamina is neck of dorsal grey horn. 6 is base of dorsal grey horn. 7 is the nucleus dorsalis, and also this intermediate region we talked about 2 nucleus, intermedio-medial and intermedio-lateral nucleus. 8 and 9 we talked about various nuclei in the ventral grey horn, medial group, central group, lateral group. Those are coming under the 8 and 9 lamina. 10 is grey matter around the central canal. I hope you remember that central canal, around that the grey matter, we called it as anterior grey commissure and a posterior grey commissure. So these are the various lamina which are present and it is called as rexed lamina. So to summarize what we have learned till now, we have talked about the external features of the spinal cord, where an anterior median fissure and a posterior median sulcus divide the cord into 2 symmetrical halves, and we studied that an anterior median fissure and 2 anterolateral sulci on the anterior aspect. And posterior aspect, we studied a posterior median sulcus, a pair of posterior intermediate sulcus, and a pair of posterolateral sulci. So posterolateral sulci is where your dorsal roots are emerging, and your anterolateral sulci is where your ventral roots are emerging. So this is the external sulci and fissures which are present in the cord. On an internal section, cross section of the cord, we studied that the grey matter is head-shaped. We said grey matter is composed of nerve cell bodies, neuroglia and blood vessels. The predominance of neuronal somata gives the greyish appearance. We talked about 2 grey horns, ventral grey horns, 2 posterior grey horns, and a central area and a grey commissure which is traversed by the central canal. Then we talked about the white matter. We divided it into an anterior white column, lateral white column and posterior white column. We talked about the white matter is composed of nerve fibers, neuroglia and blood vessels. The whiteness is due to the myelination of the nerve fibers. Then grey matter, we talked about the various nuclei which are present. Nuclei are nothing but collection of nerve cell bodies within the central nervous system. And outside in the white matter, in the anterior white column, lateral white column and posterior white column, which are also called as anterior funiculus, lateral funiculus and posterior funiculus respectively, we talked about the various tracts, the position of the ascending and descending tracts. So tract is nothing but collection of nerve fibers within the central nervous system which have same origin, course and termination, and they are named after the various grey masses it connects. So this summarizes the external and internal features of the spinal cord. We will just finish with the clinical anatomy case study. So this was a child with high fever, neck pain, irritability and refusing to eat. A diagnosis of acute meningitis was made, and the resident performed a lumbar puncture to confirm the diagnosis. Having learned the clinical anatomy of spinal cord, where it ends, the subarachnoid space, the coverings, at this stage you should be able to tell where to perform a lumbar puncture and the structures pierced when a lumbar puncture needle is inserted into the subarachnoid space. So usually answer for this is lumbar puncture. As I told, this is a 5-year-old child. Hence, in a 5-year-old child, as mentioned earlier, the cord, the spinal cord, terminates at the level of second lumbar vertebra and certainly no lower than third lumbar vertebra. So, it is better to perform a lumbar puncture below the fourth lumbar spine. So, fourth lumbar spine, as I told you, can be easily identified by drawing an imaginary line joining the highest points of iliac crest. So, you must pass the lumbar puncture needle. It is fitted with a stillet. It is to be passed into the subarachnoid space to get the cerebrospinal fluid for diagnostic purposes. So, the needle will pass through various layers as I have mentioned earlier. You can see this is the skin, then will be the superficial fascia, then you can see the supraspinous ligaments, you can see the interspinous ligaments, then it is piercing the ligamentum flavum and it is passing through the epidural space, then passing through the dura mater, arachnoid and it is entering the subarachnoid space. We said subarachnoid space is between the arachnoid mater and the pia mater. So, once it enters the subarachnoid space, the CSF can be withdrawn. So, that is the answer to this clinical case study. Having learnt about the spinal cord, external and internal features in detail, now we will do some assessment questions. First question is, where does spinal cord end in adults? Spinal cord in adults ends at the lower border of which vertebra? The answer is lower border of L1. Second question is, the structure that lies in the anterior median fissure. Anterior median fissure is 3 mm and structure present in it is, which spinal artery is present in this anterior median fissure? The answer is anterior spinal artery. So, next question is phylum terminal. We mentioned that phylum terminal is nothing but prolongation of pia mater. So, till which level it extends? Phylum terminal extends up to, the answer is first coccygeal vertebra. We studied in detail about phylum terminal, internum and externum. Externum extends from S2 to the dorsal surface of first coccygeal vertebra. So, the answer is D, first coccygeal vertebra. Next question is, subarachnoid space ends at dash level. The answer is S2. We studied that dura and arachnoid end at the level of S2 and subarachnoid space also ends at the level of S2. How many pairs of cranial nerves and spinal nerves are present? Earlier I had mentioned about the spinal nerves, spinal segment, how many pairs of spinal nerves are present. So, the answer for this question is 12 pairs of cranial nerves and 31 pairs of spinal nerves. We studied in detail that there are 8 pairs of cervical, 12 pairs of thoracic nerves, 5 pairs of lumbar nerves, 5 pairs of sacral nerves and 1 pair of coccygeal nerves. We'll just go on to the next assessment question. Define what is a spinal segment. Spinal segment is the portion of the cord which gives attachment to a pair of spinal nerves. It's a very important definition. What is a nuclei? We talked about various nuclei which are present in the anterior gray horn, intermediate region and posterior gray horn. A collection of nerve cell bodies within the central nervous system is called as nuclei. Next is tract. What is a tract? We studied various tracts in the anterior white column, lateral white column and posterior white column. A tract is a collection of nerve fibers which have same origin, course and termination. You have various ascending and descending tract. We have positioned them at various places in a section, cross section of a spinal cord. Next question is the lower tapering extremity of spinal cord is called as what? It is called as conus medullaris. Next we talked about cauda equina. So cauda equina is formed by which all nerves? Lower 4 pairs of lumbar nerves, 5 pairs of sacral nerves and 1 pair of coccygeal nerves. Next question is T12 vertebra corresponds to which spinal segment? We talked about the vertebra and the underlying spinal segment. We mentioned that corresponding to the vertebra, the underlying spinal segment will be caudal. So T12 vertebra will correspond to L5 spinal segment. Next question is phylum terminale. Phylum terminale is a continuation of dura, arachnoid, pia. Which one of these? It is a continuation of pia mater. We talked in detail about the phylum terminale, internum and externum. This picture, please identify the nuclei marked 1. We have talked about various nuclei in the posterior gray horn, intermediate region and anterior gray horn. So what is this 1? 1 is substantia gelatinosa. The last question is identify the hidden tracts in the picture. What is this tract? This will be your descending tract, that is lateral corticospinal tract. This side you can see 2 tracts, one is anterior, another one is posterior. These are nothing but anterior and posterior spinocerebellar tracts. That completes the assessment. Thank you.